I follow the American Cancer Society. I also tend to follow the American Society of Breast Surgeons recommendations, which say that you should get a mammogram at 40, and you should get a mammogram every year until you are not in good health. So for some women, that's 65 with a terminal diagnosis of some other disease. And for other women, that's 105. So there is no stark age cutoff. I think the recommendations were written with the expectation that in the early 90s, most women were getting breast exams in their primary care offices, and most people had access to their primary care doctor on a very, very regular basis. Generally speaking, when I'm talking to women about their screening program, I think it's actually most important to address early in life. So I tell women that you need to understand your breast health in your screening program when you turn 25. In the women ages 40 to 50, it's complicated, right? We know that this group of women tends to have increased breast density, which makes screening mammograms less sensitive. But we also know that in this age range, we tend to have more aggressive tumors. I think it's important for women to understand the difference between finding a breast density on a mammogram and having dense breasts. A lot of time in the office, I spend educating women that not all breast cancers are created equal, right? Breast cancers can be wildly aggressive, easy and eager to spread, right? And breast cancer never killed any woman by growing so large in her breast that it ate through her chest and swallowed her heart, right? Breast cancer kills women because it has this proclivity for spreading to places it doesn't belong: lungs, liver, bones, brain. I tell everyone, men and women, if you ever have a lump or a bump in your body where a lump or a bump doesn't belong, or where a lump or a bump wasn't there yesterday, you should bring it up. So many of us prioritize, especially as women, we tend to prioritize our families, our jobs, our neighbors, everyone except ourselves. I've heard many women with advanced stage cancers say like, oh, well, yeah, I've noticed that. It was there a few years ago, but it wasn't hurting me. I had other things I needed to do, kids I needed to get taken care of, and, I just put it on the back burner. And here they are 4 years later with a giant breast cancer. So for all humans, you're in charge of yourself.